Okay. Awesome. Does it look like it's on? Blue light's on? Okay, good. Hello. Hi, guys. A lot of familiar faces and some new faces. So welcome to the Jimbo seminar tonight. My name's Dr. Megan Strodel, and I'm a naturopath in the area. Before I dive into the subject, I do kind of want to, if you guys know what naturopathic medicine is, explain it. Have you guys heard about what a naturopathic doctor does? No? I know you have. A little bit. Okay, yeah. So a naturopathic medical doctor goes to a naturopathic medical school. We receive 4 years of training in all of the sciences, but we also learn all the nutrition, all of the homeopathy, herbal medicine. So we are what I like to call the experts in alternative medicine. So when we look at a person in our office, we think about, why are you not well? What is actually causing disease here? So we're trying to find the root cause of your issue versus someone that comes in and they're immediately prescribed a steroid or a birth control pill or an antidepressant, whatever it is. We are allowed, and depending on the state, able to prescribe drugs. We do learn that in school. Anything that you think about your primary care doctor being able to do, that is our training, and then our scope of practice differs on the state. So I see a lot of people ages, 10 to 93. I think I had a gal that old. And we usually will sit down and take a really big deep dive into somebody's health. I spend usually an hour with people, sometimes 15 minutes if it's quick, sometimes a half hour depending on kind of what we need to do. So I get to really know, why are you sick, or why do you have the symptom that you have? And we run lab tests and lots of fun stuff, which we can talk about kind of throughout the night. But I look at things very differently. So you'll often hear me talking about how my perspective differs from like the conventional view. But I think we all need each other because medicine is such a vast thing. There's so many things to consider when we're giving someone treatment. And so we need to do more tag teaming. But I want to hear from you guys, because typically I make my nights on a very specific subject, but I deal with a lot of women's health in my practice. So I kind of wanted to open it up and talk about a couple different topics throughout the night versus just menopause or just healthy cycles. And so I'm curious what you guys all have in mind, because we can kind of tailor tonight to that. And if not, I can just kind of talk and do some education on a couple of like the bigger topics that people tend to worry about or have questions on. Osteoporosis, okay. Kind of in women's medicine, but kind of, that can be quick. Anybody else? Okay. Yeah. Mm-hmm. Yes. Any specific age you're looking for? Just in general?
Well, yeah, I think just in general, I think the hormones are different when you're 14, like my 14-year-old, you take what your old stuff, and then
Yeah.
I'm like my old stuff.
Okay, yeah.
But hormones are hormones, right? I think the balancing of the hormones is important.
Yeah. Yeah, we can talk all about that for sure. Anybody else? Okay.
As well, I have a teenager.
Yes. Okay.
Acne, stress.
Acne stress. Mm-hmm. Awesome. Yeah. Yeah.
Hormones and how they affect like migraines for
Okay. That's a good one. Hormones and migraines. Okay. Anybody else kind of want to chime in? Okay, cool. We might have a couple stragglers, so we'll see what they say. Okay, so let's do this. So, women's hormones change all throughout our lives, right? So, I want to take you through, adolescence, 13, 14, all the way up to postmenopause. And we'll talk about what happens in the hormones or with the hormones in each stage. So teenagers, adolescents, then we have what I call the fertile years, the childbearing age years. We have, when I turn around, can you guys hear me?
Yes.
Awesome. They've done the acoustics in here. Then we have perimenopause. And we have menopause. Oh gosh, my spelling is atrocious on the board, so I apologize in advance. Menopause and post-menopause. Yeah. Oh, is that what that is? I don't have a cloth though. Oh, great. Woo! Perfect. Okay, so every stage is totally different, as a lot of you women have probably heard about or experienced or are going through daughters going through this. So what happens at the beginning of the teenage years that no matter if you're a boy or a girl, you must go through? Puberty. Perfect. Okay, so what happens during puberty? Like, why is puberty a thing? What is the main thing that's happening to cause all those body changes? Hormones? Yeah, I mean, that's really the answer. It's that simple. Hormones is inducing a lot of body changes. So when, I guess we should put kid over here. When you're a kid, you're growing and developing just as a human being. And then your puberty is when the sex hormones come in. And we start to develop, breasts and hair and all that fun stuff. But it's actually the time when your brain starts to talk to your ovaries or starts to talk to your testicles to make hormones and or make the sex cells, like for men, sperm. For women, we're born with all of our eggs, but we have to start having a cycle, a menstrual cycle. We have to start using those eggs. Okay, so your sex hormones, which for this discussion, I'll put up here kind of the top ones. Estrogen. Estradiol is the most common form because there's 3 different types of estrogen, which we'll talk about in a little bit. Progesterone and testosterone. So if you're a man, this is what mostly ramps up for you. If you're a woman, this is what is getting us. And all of these hormones give us those secondary sexual characteristics, and all of a sudden we change from looking like a little kid into looking like, a man or a woman, kind of in miniature form, and then we continue to grow, right? So there's lots of different things that are happening during this time. With the physical changes is also coming kind of repercussions of these hormones. Like you guys were saying, my teenager has acne. So this is a big piece here. Anything else that your kids are going through? Probably, stress. The schools here are hard on a lot of kids. At least that's what a lot of my teenage patients will tell me. They're working me too hard. So these are going up. And for women, we are establishing the menstrual cycle here. Menstrual cycle. So the period is coming. Awesome. As women, we are essentially programmed, designed to have children. That is our biological bent. No matter if you want to have children or don't want to have children, your body's going to still say, your body's still going to have that ability. So in your teenage years, these all go up, and we have a period that happens. When your body is establishing your menstrual cycle, what happens is that your brain, does it look like a brain? Everybody's like, oh. That's funny. So, I mean, you have different parts of your brain. Maybe I should have drawn the cerebellum smaller, but part of your brain called a pituitary gland, which this is not to size, but it's pituitary gland in your brain. It's the same thing. Everybody's smiling. Yeah, it looks funny. Okay, haha. So, you know, if you're a woman, we have a uterus and fallopian tubes and ovaries. Look familiar? Biology 101? Yes. So your pituitary gland, for any gland in your body, whether it's your ovaries, testes, thyroid, or adrenal glands, makes a hormone, but your brain has to tell the gland to do that thing. Just like the brain tells my arm to go over here or tells me to say my next word, your brain has to tell your actual glands to either make your sex hormones or to actually create, in the terms of the man, the actual sperm cells. But for most of this, we're going to be talking about women, so unfortunately, I'm going to leave the guys out kind of from now on, okay? Brain has to talk to ovaries, and when you are 12, 13, 14, sometimes kids have their period starting at age 8 or 9, which is starting to be really early. Usually it's 11, 12, 13, at least that's where we kind of hope it will be, so they're a little bit older. Your brain is just starting to talk to your ovaries with a couple different signals. FSH and LH. And these tell the ovaries, yo, make estrogen and start to have a period and ovulate. Okay? So the way that I like to think about these hormones, FSH is follicle stimulating hormone. And what do we call the thing that gets the egg ready before ovulation? It creates a follicle. So that's kind of where that term comes from. So whenever you're about to ovulate, you have all these eggs in here chilling out, and they stay with you your whole life as a woman. You're born with them. They're all chilling in there, and they're all dormant, they're all quiet, they're all tucked in their little beds. But when ovulation happens, they kind of go, there's a couple of chosen ones that, you know, head to the front of the line and they start to get prepared and they get their hair all done and they put on a pretty dress. And then the chosen one actually is the one that gets ovulated. And the ones that don't get chosen, they kind of reabsorb and then go away. Go to the back of the line. So this essentially gets the egg ready. This is the egg, I call it the get egg ready hormone, because we have to get the egg ready to be ovulated. And then LH says release the egg. Okay. So let me back up for a second, because we have a period, but why do we have a period? Does anybody know this? Yeah, clean out the lining of the uterus. We have a period in the whole menstrual cycle so that we have an environment to make babies. That's like the very basic idea of it. But we have a period because when these hormones go up, especially estrogen for us women, that creates a lining inside of your uterus in here that eventually needs to slough off and come out. Okay, so if you don't have estrogen levels that are high enough, you won't have a cycle. So whether you're a kid before puberty, your estrogen levels just aren't high enough to have a cycle, or whether you're in your fertile years, which can be, 12 to the average age of menopause is 51. So your fertile years, which stops sometime in here, fertile years. So where was I going with that? So you have, this happens every so often.
What age is perimenopause?
So that varies on the person. So, you know, if we're thinking this is age 12, fertile years, the average age of menopause is 51, and that's no period for a whole year. That's no bleeding whatsoever. You can start that process anywhere between 8 to 10 years where your cycle starts to become irregular. And we'll talk about that a little bit. So usually it's dependent on your family history. What other women in your family went through those changes can kind of help dictate it, because it is a little bit genetically programmed, but it's also helped out a lot by your environment and how you feed your body and fuel your body and stuff like that. So this can be anywhere from 1 year and you're done to you're kind of on and off for 10 years. So, you know, 1 to 10 years. But we were talking about why you have a period. So even if you are in your fertile years and you don't have enough estrogen, you're not going to have a period. And that's why a lot of women will lose their period for some reason in their fertile years when they're not pregnant, which is called amenorrhea, which is lack of period. Does that make sense? So we have a period because we have estrogen as women, and that creates this need, or the estrogen creates this nice bed for any little egg that's been fertilized to go. And then once your body's like, oh, I didn't get fertilized, your body's like, okay, I got to clean this out and create a nice new environment for the next possible month. So that's why we have this rhythm. It's because of the signals of estrogen, and it's because this lining needs to get sloughed off. But what is the other part in the menstrual cycle is the actual ovulation piece. Okay. Can you have a period and not ovulate? Yeah, you can have a period and not ovulate, which is very common. So generally, our estrogens will give us our periods, and then how healthy we are will determine whether we actually have an ovulatory cycle. Okay? So you can have something called an anovulatory, there we go, cycle, or an ovulatory cycle. And you can have a period without releasing an egg. Your LH signal happens about mid-month and tells you to release an egg. But you have to have enough estrogen to have a ovulatory cycle. You have to be eating the right foods, not stressing yourself out, not having anything crazy going on. There's actually a lot of women that don't ovulate with their periods. So we have FSH and LH telling the ovaries to ovulate and make hormones. So FSH and estrogen are buddies, and LH essentially is the ovulatory signal, ovulation. So when you are a teenager, your brain and your ovaries are learning how to communicate. It's kind of like when you meet a new friend and you're texting and sometimes things kind of get lost in translation. That's what your brain and your ovaries are doing. They're sending signals back and forth. Mostly the brain is talking and the ovaries are choosing whether or not to respond. But because they're learning how to talk, it creates a lot of up and down in young girls' cycles. So for instance, women that are in fertile years generally have very regular cycles. So their hormones are doing this nicely every month, up and down, ovulate, dump it out, up and down, up and down. But when you're a child or a young girl and you're learning, your ovaries are essentially learning what to do from the brain. You might have your first period and then nothing for another 3 months. And then the ovaries are like, oh yeah, that thing I got to do. And then they'll have another period. And then next month you'll have a period, but then you won't have it for 2 months. And this is actually totally normal. Okay. So I will say that irregular cycles are normal. I would say it depends on the situation, but it can sometimes be up to 2 to 3 years. Your cycle doesn't regulate immediately. Some women will get their first period and then every month after that continue to be regular, but it's not the case for every woman. Okay, so irregular cycles are normal for about 1 to 3 years. The literature might have a certain opinion on this, but I kind of go by what I see in practice and the situation that we're dealing with. So, your brain is learning how to talk to your ovaries and vice versa. So, signals can be irregular in terms of how often you get your period. And your body is also learning how to do this stage. It's actually kind of learning how to ovulate. Your ovaries don't always ovulate every month, especially in this stage, because they're learning the process. So there's lots of what we would call anovulatory cycles in your teenage years, which can lead to a lot of just typical hormonal imbalance. So when we're thinking about the menstrual cycle, I'm hoping some of you guys have seen some of this. Let me draw estrogen and progesterone. Here, I'll label these. This will all make sense in a second when I explain it. And this is not perfect, but if you look something like this up online or in a textbook, it will look something like this. So, So this is what your hormones are doing in the menstrual cycle. If this is day 0, this is somewhere in the middle, like day 13, 14. And then this over here is about day 28 to day 30. Because a typical menstrual cycle is about 28 to 30 days, but it can be variable from 21 to 35 and be normal. It all depends on your physiology, your family history, your genetics, how you metabolize hormones, kind of everything. But this is the goal for what we're seeing happen with the hormones. So day 0 to about 7 is when we bleed. For every woman, it's different. Sometimes it's 3 days, sometimes it's 7 days. Sometimes it's shorter, longer. And then in the middle, so you get a period because you have a high enough level of estrogen, but you keep having a period because of this cycle of hormones. The hormones will build up, and then when they both drop at the end, estrogen and progesterone, that signals another bleed. And then you have to build up the lining again and build up the hormones, and then the hormones drop, and then you have another bleed. So this here is where the hormones drop, which signals a bleed. Okay. These are the main ones. So E is estrogen. So when you're in your period, your hormones are coming down, so you're kind of like, oh, they've dropped or they're slowly declining those first couple days. And then your estrogen's kind of, it's not low like progesterone is at this time, but it's moderate. It's, around 50, 60, 70, depending on the woman. And then it will pop up a little bit with FSH before you ovulate, and then it will pop up around day 21 of your cycle. Your LH signal looks like a peak, just like this, and it's what actually gets you to ovulate. When you ovulate, you make progesterone. The reason why we talk about estrogen and progesterone is because we need them to be in balance. The only way that you have them naturally in balance is if you ovulate. We need to ovulate as women to make progesterone. And if you're a teenager and you're not ovulating consistently, you have lots of estrogen flying around, but not a lot of progesterone to balance it out. And progesterone is naturally very calming. So think about your teens. They're like, school and sports and because they might not be getting that nice, calming, grounding type of effect of the progesterone. But regardless of whether we want to have babies now or later or never, we still want to ovulate because we want to have naturally balanced hormones, or at least that's my perspective. Okay? So the only way we make, ovaries make your estrogen. Some of your adrenal glands do, but we'll talk about that later, so I'll mention it. So you make estrogen in two spots, your ovaries, once you get your period, and your adrenal glands, which is another gland that helps make cortisol for you, that also helps manage your stress. So we make it in two different places. And this will become relevant when we talk about menopause, because your adrenal glands will kind of save your butt in menopause. So estrogen happens. We need the progesterone to balance it out. We make progesterone two different ways. Pretty much ovulation. But when, see, how do I want to explain this? You need to ovulate to make progesterone. And the reason why, well, I should say this. You make progesterone two ways, ovulation or pregnancy. Progesterone stands for progestation, so it helps you, it makes pregnancies viable. So if we zoom in on the egg here, what we're seeing is a nice piece of tissue that's mentoring and holding the chosen one. Once the chosen one leaves and goes down the tubes on its journey, then this tissue here that's left behind makes the progesterone. And it's called the corpus luteum. So the egg comes out, it kind of meanders down the tube, and all the cilia in the tube keep it going where it should go. And then the tissue here is like, okay, progesterone, I'm going to make some progesterone to balance out the estrogen. And, it creates a nice environment just in case a sperm comes in here and ovulates and we make a baby. Exciting, exciting. So the corpus luteum has to make the progesterone for you. But corpus luteum is a tissue type, just like any other tissue type in the body. So, you can have unhealthy brain tissue or unhealthy skin tissue or an unhealthy muscle or unhealthy liver tissue. So we need to have good, strong, really ovarian function to have a good, strong corpus luteum to make a good amount of progesterone. Yeah.
So, like if a female goes like, say, on birth control,
Mm-hmm.
Effect on
So that's a great question. And let me talk about that once we get through this, because that's going to be a perfect segue. And if I don't talk about it in about 5 minutes, just remind me. Okay. So we ovulate, the corpus luteum makes the progesterone, the egg goes down. For most of us, we're not ready to get pregnant, or we're just going about our day. It's not, the right time. We're not planning on it. The progesterone goes up. It's really low first half of your cycle, and then it goes up. And you get this nice progesterone hit second half of your cycle. Helps to balance out the estrogen peak. And then sometime in the second half of your cycle, things start to come down, and your hormones drop. This is also where PMS lives. Everybody knows what PMS is, right? Premenstrual syndrome, because it's happening before your period. You can also get like ovulation PMS too. There's lots of different symptoms women get. So, yay, we made progesterone. We need progesterone to balance out estrogen because we need both hormones to have a healthy menstrual cycle. The other, way you can make progesterone is if you get pregnant. Because if the sperm and the egg come together, they're going to tumble down and come and, take up shop right here. And then your body's going to be like, ooh, implantation. Okay, I must make progesterone to start everything going. So for most of us, because we're only pregnant for a certain percentage of our lives, most of us are in this ovulation, corpus luteum making progesterone camp. But there are so many things that don't help us make progesterone, or that kind of steal our ability to. So stress is kind of the biggest thing ever for women. I think women are great, but our physiology is not as robust as it is a man, if you compare it. Just the way that we're genetically designed, we're designed to have children. Men are more so designed to deal with stressors. So any stressor that might be, easy for the man in your life, we will deal with it differently as women, just because of how our hormones are different than the men. So any sort of stress. And let's talk about birth control, because this is a good spot for it. So when you are in this age group, your brain and your ovaries are learning to talk so that you can have an established menstrual cycle for the next stage of your life as a woman, right? Does this all make sense? Okay. But in society, it's very common idea that if you have irregular menstrual cycles, that's not good, which is true. But in this stage, it's really, really normal as things are getting established. But what happens a lot in this stage is that young women are put on something like birth control. So women can be put on birth control really anywhere in this stage, but this is one of the most common, which I think is really sad because this is just starting to mature. So if you are, a young girl and you're having heavy, painful periods that probably aren't ovulatory and different things, and they're irregular and you're getting acne, it's just your body responding to like, oh, hey, you're making a lot of estrogen and testosterone all of a sudden, so we got to figure out how to deal with this. There's things that we can do, which I'll talk about after this. Treatments. So girls get put on the birth control pill. But what the birth control pill does, do you guys know what the point of the birth control pill is? It's so that pregnancy doesn't happen. Right. But do you guys know why pregnancy doesn't happen with the pill? It gives you synthetic hormones. But the reason why it works is because it essentially cuts off the feedback loop. So it goes in here and chops off the signals. The way that it does that is just by giving you a low dose of synthetic hormones, which are very different than your own natural, gentler hormones like estrogen and progesterone. So any sort of oral contraceptive pill is not what we would call bioidentical, which is a term that we'll talk about in the menopause time frame, because bioidentical hormones are identical to what we make, and they can be very helpful in different stages of life. So you put in a birth control pill, and you've got all of your hormones raging, whatever stage you're at. You've got plenty of them, whether you're fertile, and they're all up and down when you're a teen. So we have all of those hormones that our liver has to deal with and detox, plus we're putting in synthetic hormones every single day, except that 7 days where we have a break from our pill pack. And so we're throwing a lot of hormones into the system. And that's why a lot of people will get acne and heavy periods, their hair falls out, weight gain, lots of different symptoms of oral contraceptive pills, which you also will often have when you get off of them, which is a whole kind of different topic. But we put in those synthetic hormones, it chops off the signals, but it does this by suppressing ovulation. So by putting in those hormones, it suppresses the ovulation. So this looks like that nice up and down, up and down, up and down menstrual cycle, because this happens every month. When you are on the pill, I don't really want to, yay. Okay, this is dry erase. This is not permanent. When you have the pill, you're literally a flat line all the time. You just have a steady state of synthetic hormones, which can be really good for treating some conditions in the short term. Like if you have ovarian cysts that tend to rupture, those are due to hormones. If you want to not get pregnant, if you're flatlined, there's no ovulatory signal at all. So the pill works by suppressing ovulation, which is really effective, but it's not what we want for our bodies and how our menstrual cycle develops over our life. So I think there are a lot better options to pick than the birth control pill. But I mean, I have patients in all different walks of life, and we have to have some really hard discussions sometimes about, like, what is your goal? What is your, what are your habits like? What is the possibility of you getting pregnant? What are the risks, benefits of whatever birth control we decide to do? But I will say, I try to dissuade people from the pill in general, because it's really bubbly. Sam recommended that to me, so it's exciting. But yeah, it's really bubbly. Excuse me. So there's just lots of different ways that we can not get pregnant. We don't necessarily need to suppress all of our hormones to do that, because the pill has secondary effects. It can lead to anxiety, depression in women. It can lead to hair loss. It can lead to loss of libido. It can lead to lack of energy. It can lead to leaky gut and gut health issues. It changes our dysbiosis. It leads to deficiencies in lots of different vitamins. And I just don't think it's the best choice. Sometimes we need to go there. If we do, I'm never prescribing it in here, because we need this whole system to mature. That's really vital for over here, because I have worked with a lot of women who, they were young, they got on the pill because their periods were bad, probably because they weren't ovulating, probably because their liver was overwhelmed. They needed some really easy, quick, natural treatments that, naturopathic medicine could have provided to them, but they didn't have access to that then. And we can't go back in time. So we chopped off their signals, their whole system didn't get to mature. So then when we're taking them off, in the fertile years or in perimenopause, and they're either trying to get pregnant or trying to have a regular cycle before menopause and get the hormones out of their body, then it's either really hard for them to get pregnant, or it's really, really hard to establish a cycle for them, because it's like you have to go through reverse puberty, or you have to go through puberty at, one gal I was working with, she was 38, 37, 38, 39, 40-ish. And she had never had a normal period besides one being chemically induced with some sort of progesterone challenge or with a pill. She had never, ever had this mature. So when she had done her own research and learned, maybe the pill isn't the best choice for me late coming on in life, we had to do a lot of work to actually reestablish a real menstrual cycle for her. And it takes time, because it's a delicate system. I think it's something that we tend to take for granted, especially if you're a woman that has really easy periods or really regular periods. I see people all over the gamut. So it's a really powerful system, and it's a system that really helps us be women too. Because estrogen gives us our femininity and our softness and, all those fun things. So birth control pill, if I'm ever using it with people, it's somewhere in here for a very specific reason. I try not to give it in the teenage years. But sometimes your teen is deciding to do things that you wouldn't necessarily want them to do, or engaging in certain behaviors, so we choose to do it. So Unfortunately, with any birth control, there's always a negative side effect. That's except for abstinence, which, is a whole other discussion. But let's talk about, did that answer your question about the birth control? Okay, great. When we're in this time frame, there's a lot of acne, irregular periods, heavy periods, painful periods, and some of that is due to the influx of estrogen without any progesterone yet, so we're not ovulating, and some of it is like especially skin issues when you're a teen. It's usually something going on in the gut, some food allergy that we don't know about, but acne in kids, especially the boys, you guys. When you're seeing a 13-year-old boy with just a face lit up with that red, inflammatory, very pussy looking acne, his liver is totally overwhelmed with the amount of testosterone that his testicles are now making. But how do we treat acne? We put topical stuff on it, and that's pretty much all we do, but it's coming from the inside. Anything, I like to think of the skin as being a gateway into what's happening internally, both in your digestive system and in your liver, and sometimes your lymphatic system, sometimes any system. Pick it. Skin is related to it. But if it's not going well internally, it's going to show in your skin, whether it's acne, whether, it's melasma is very common in this stage. Cystic acne is a big one. It's all tied to a lot of detoxification issues. So with the teenagers that I work with, we usually really do a deep dive on diet, getting sugar under control. Sugar is huge. Sugar doesn't really help anything, so we try to take that out of the diet, and also really just support the liver. There's a lot of herbs that you can give people that are very supportive and just help the liver naturally do all of its detox processes. Okay. Does that make sense? Okay, cool. Any questions about this time frame? Okay, cool. So I'm going to take away our block signals because we need them open for the rest of the night. Okay, so now we're moving into the fertile years. So this is the years that you could possibly have a baby. This is the majority of a woman's life. This is a long time. So this is like, 12 to maybe, for some women, 40, 41, 42. And that time frame varies on just your family history. I see women enter the next stage. What's happening over here? Here we go. I see women entering the next stage more so around 45, 46, 47. Not everybody is in a really long perimenopausal time frame. So we'll talk about that in a second. But in our fertile years, this is when we're having babies and we're hopefully having an ovulatory cycle where we're releasing eggs, we're making hormones, and we're able to get pregnant if we need to. Often in this period of time with people, I have to work on a lot of preconception care, because the healthier that your body is as a woman, but also with your man as a couple, the healthier that your baby will be, and the easier that your pregnancy and your recovery after baby will be as well. So we're born with all of our eggs, but they're laying in there sleeping dormant. So it takes about 4 months for them to really, what is the word I want? Where they essentially get called up to get used. So if someone wants to get pregnant, I start preconception care at least 4 months, but ideally 6 months to a year. And in this time frame, we do often a detox. We get stuff out of your body, both for the man and the woman, because the health of the sperm makes a big difference in the health of the baby. For a long time, it's been thought, it's just the woman. The woman does all of it. No, dudes are half of the equation. And it's a big equation because the swimmers, the sperm, they have to swim all the way up to like here, you guys, and meet the egg. So they have to be shaped the right way. They have to have enough nutrients stored in their little organelles. They have to like make sure that they swim even the correct way. They have to not be too heavy or have like 5 heads. It's just, it's crazy. So their morphology and motility and their count has to be high enough. So we're always working on the men too. But with couples, I'm trying to get them at least in the 6 months so that we do a detox. We optimize nutrients, and we work on stress. There is a lot of infertility, I think, publicized now, or at least we're more aware of it than I think we ever used to be. And part of this is because fertility makes money. So whenever there's a trend in medicine, you have to think, why is this a trend? Sometimes it's because it's a legitimate thing. Sometimes it's because it's a moneymaker. The fertility industry is a big moneymaker because those fertility centers are not regulated at all. They have certain guidelines that they have to follow, but the American Medical Association is not going into those fertility clinics and saying, you need to abide by these rules, you need to standardize your procedures, you need to make sure that you're educating women about XYZ different topics before you're, say, jumping immediately to IVF, or, that's the most common one. But I say that because there's lots of issues that can go wrong with this. If you are a woman who has sometimes an anovulatory cycle for whatever reason, one of the biggest reasons is something called PCOS, which is polycystic ovarian syndrome. Have you guys heard of that one? Yeah, so it's super, super common. The way that I want you guys to think about this is really ovarian dysfunction. I think it should be renamed. The ovaries are dysfunctional because of some issue, whether it's you're making too high androgens, there's inflammation in your body, you have blood sugar and insulin issues, which is like one of the most common ones I see, or you're just coming off of birth control and your cycle is totally wigging out, your brain and your ovaries are like, what happened? I was kind of dormant for a while and now you're trying to ask me to work, like what is this? But this is so common, and I think it's overdiagnosed. But ovarian dysfunction is kind of what I want you guys to think about, because we can get really bogged down into, I have PCOS. I see a lot of people like that. But no, you have ovarian dysfunction that we can help you become more functional. So it's not a, no baby sentence forever. But these women tend to have long cycles that are sometimes anovulatory. So, the typical cycle is about 20 to 30 days. So if you're a healthy woman, you try first couple of cycles and typically you get pregnant. For women that have longer cycles or anovulatory cycles, you do a lot of trying and timing sex within your fertile window, but nothing happens. And you obviously can't fertilize an egg if it's not there. So sometimes I have to work with women just even on this piece in this time frame and just getting their whole menstrual cycle working really, really well so that we can get to the baby stage. So if you have girlfriends, know of anybody that is going to be in this stage, make sure that they see someone who has knowledge about natural medicine who can help them have a really healthy, happy pregnancy. And then also the postpartum recovery, which is like trimester 4, we all joke about. Parents need a lot of support, baby needs lots of support. And if you are a healthier woman going into this, you'll recover better, you'll just, everything will go so much more smoothly. And your nutrient levels, this whole optimized nutrients thing, your nutrient levels will directly affect the nutrients that you give the baby and the baby's trajectory for life, like IQ and like just pretty much everything. Their thinking ability, the way that their brain forms, the way that, because we have genes in our body that are like the blueprint for all of our cells and all the processes in our cells, but it's the environment that changes how those genes work. So if you're a mom who has a lot of deficiencies, when you're making the baby, you're not setting the baby up well for later on, because their genes are going to respond to the fact that there's not enough nutrients to really do what they need to do. So this whole idea of epigenetics, which I'm not sure if you guys have heard of, but it's a cool field. It's the idea of what you are doing to yourself or your environment changes how your genes are, and your genes tell you essentially what's going to happen, your physiology, the way you think, if you're going to respond to XYZ vitamin, everything. So preconception counseling, really important. What else do I want to say about this stage? But your period over here is kind of all over the place. Then we get into this nice fertile period where hopefully we're doing this awesomely every month. And then perimenopause. Okay, I'm going to move on. Are you guys kind of good with that stage? Anything you want to talk about? Melasma. So melasma is a darkening of the skin on the face. Usually happens after pregnancy and is due to a lot of progesterone. It's the hormones that give you that kind of, they sometimes call it like the raccoon mask. But you'll see it on different women. A lot of people will cover it up with makeup. It's really common, especially on the forehead, and it can be really dark. It's because when you're pregnant, you make massive amounts of progesterone, like massive. And then when you have the baby, you go through that whole change, body-wise, but then your liver also has to detox all of that hormone, which is really overwhelming, as we learned over here. So sometimes we just need to go back to the drawing board, do some detoxification, and everything improves for the melasma. Yes. It depends. People call liver spots different things because there's age spots, there's liver spots. I'm specifically talking about the whole melasma, the actual stuff on the face. But that can be improved. Let's see. We talked about PCOS, we talked about preconception, talked a little bit about skin issues. The one thing that I will say about skin issues is obviously you got to work on your gut health and getting your diet all on track, working on your liver. But you can do some very natural procedures that do help, like the contour and how your skin works. I don't know if you guys have ever heard of, where should I put this? The vampire facial. Yes? No? Yeah. So it's essentially taking your own blood and spitting it down a lot so that you get your serum. In your serum are a lot of amazing stuff, cofactors, different immune cells. And so what the person who's doing the procedure will do is use a special pen that makes these little micro abrasions. And I don't do this, so I'm not explaining this perfectly, but some of my colleagues do. But it's amazing for melasma, acne scarring, because acne can be very scarring for all my women in this time frame, especially if you have any sort of hormone disruption and you get the cystic acne, or the boys that have just a whole face of acne and we're picking at it and it leaves the scarring. So you can do the vampire facials, which is really called a platelet-rich plasma facial with I think they call it a derma pen, but it actually helps you regrow collagen. So it helps you helps your skin look more youthful, but it also helps with the contour of the skin, the color. It's really it's just a very regenerative therapy, but you're not using any chemicals. You're literally using your own serum that we took from you, 30 minutes ago and spun down, and causing some little micro tears, kind of like when you go to the gym, you lift something heavy, you put a little micro tears in the muscle, and then what happens to the muscle? It rebuilds, it gets bigger, it gets stronger. Same thing with your skin. So if you have had a difficult time skin-wise in this period of time, I definitely recommend looking into something like that versus like chemical peels and all of the chemicals in the facials. You'll pay a lot more for this, but your results will be totally transformative. So It's amazing.
Excuse me.
Yeah.
You mentioned if there's some herbs to strengthen the liver.
Yes.
Can you mention it?
Totally. So there's a couple I like. Liver. So some basics. Artichoke is great. Burdock root is great. Turmeric is actually really good for the liver. We can do some foods in here. Onions, garlic, like all of the brassica vegetables. Anybody know what those are? Yeah. So cabbage, Brussels sprouts, kale. Kale might be in the other group, but it's still one of those good ones. Anything that's going to help. Anything that's green and leafy, think that is like the mecca of vegetables. That is like the vegetables that you want to have at least on the daily. So green leafies. And that can be stuff like spinach, kale, all the way over to like butter lettuce. Anything that's green and leafy. Darker the better. So brassica vegetables are like cabbage and Brussels sprouts. Herbs, parsley, cilantro. Celery's a great one. What other liver ones do I want to say off the top of my head? Some of them have really long names, and I don't necessarily want to spell them.
So would some of those be like a green juice and you drink it? Or
Yeah. Yeah, so the liver herbs that I talk about, I usually just give in a supplement because they're powdered, it's easy to take them, and it's easy to moderate that. So like one of the ones that I just used with a patient today was Gaia has I think it's just called Liver Cleanse. Lens. And it's great. There's lots of other ones, and sometimes you can put different compounds in it, like I didn't put beets on here. Beets are amazing. So yeah, I sent a product list. Did it get through the email?
When did you send it?
2 days ago?
I did not do it.
Dang it. Okay. Well, that's I'll have to take that up with Leilani.
Oh, yeah, she didn't support it a lot. Do you have support it?
No, I don't. Okay, send me yours. Okay. But there's lots of different liver supplements on the market that are really great. If you guys want, after, we can go downstairs and kind of pick out a couple from the shelf for a couple minutes, because usually we have some products, so we can do that really quick. Okay, let's move on. Perimenopause. Perimenopause is an amazing time frame where you are approaching menopause. This tends to be a really scary time for women because we've all heard what our mothers and our grandmothers went through, and like your period stops and what's all that about? And your doctor doesn't really tell you what's happening. So that is what I want to tell you about so that you know. So when you're a kid, everything's up and down with your cycle. And then it regulates and becomes nice. Perimenopause is similar to your teenage years in the sense that your ovaries are going backwards. They have worked for your brain and they've worked very hard for you your whole life. And they're kind of done listening to the brain. They're done ovulating. They're tired. They've done their work. They maybe have given you a couple of babies. They've given you lots of progesterone. Everything's awesome. So this is when the ovaries essentially start to shut down. What's happening is that the brain is telling the ovaries, work, please, work, please, work, please. And your ovaries work separately. They don't both ovulate every cycle. One takes responsibility. So for instance, sometimes it's like do, 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 do. Sometimes one goes, next month it goes again, and then it switches, and then it switches again. But in general, we have a switch off motion for the ovaries. So some women will notice that their every other menstrual cycle is a really bad one because maybe that ovary is less healthy than the other ovary, and then their next cycle is a lot easier. So you can have just some subtle changes in your cycle just because you have an ovary that maybe it's adhesed a little bit, or has some endometriosis, or it has a cyst that popped when you were 16 that calcified and that changed its, function, different things like that. So brain is telling them to work. The ovaries are essentially becoming erratic if they are listening to that signal. So you might ovulate 1 month from, ovary number 1, and then ovary number 2 doesn't ovulate, and then ovary number 1 doesn't ovulate, but then ovary number 2 ovulates again. So it's all, and if we're not ovulating, what's going to happen? We're not going to make progesterone, and our hormones are going to be more all over the place, right? So because the ovaries are on the fritz, it makes your hormones do this. I'm gonna change color. Your hormones start to kind of go like this. They're up and down and up and down and up and down. But what does this look like? They're on the downward trend. So as your ovaries start to say, thanks, but no thanks, your hormone levels are slowly declining. Because what happens in menopause is you don't have your period. If you don't have your period, you're not getting that big hit of estrogen and progesterone anymore, right? Because that's what happens in your period. So your perimenopausal time frame is essentially establishing a new normal, and your menopause levels of hormones are just steady. So they're high and alternating, then you kind of go all over the place, and then you come down here at a new normal. Does that make sense? So you have all of these changes because your ovaries, their function is changing. They're shutting down. But a lot of women in this time frame will have heavier periods or lighter periods or skipped periods or really, really, really heavy bleeding or really, really painful periods, or their period will disappear for a couple months and then it will come back. Or they'll get really moody 1 month and they'll be fine the next. They might have breakouts. They might have hot flashes are very common. You might see changes in the vaginal tissue, which is usually atrophy. You might see changes in your lubrication levels, so your ability to get wet during foreplay, sex, the whole process. And sometimes pain with sex. Sometimes you get more UTIs because the estrogen in the local tissue is changing. That's a whole other topic we can talk about. But it's essentially getting you to a new normal, which is kind of back to over here where you were nothing. Menopause is nothing. You have low amounts of estrogen. So I would say this line is estrogen. So you have what we call lower circulating amounts. And they're not fluctuating. They're staying the same because you don't have a period, and a period causes those ups and downs of the hormones. You also, because you don't have a period and you don't have enough estrogen, are not ovulating. So you're not getting that progesterone response. So sometimes we see a lot of like insomnia here. That's very, very common. A lot of like anxiety, a lot of like feeling frazzled, nervous system wise, a lot of feelings of overwhelm. That short fuse, like if you guys think about the menopausal woman that society has coined, it's like she's short, she's angry, she's not kind to her husband, and she won't have sex with you. And it's because, her vaginal environment is changing because the hormones are changing. She doesn't have progesterone, which is naturally a hormone that blisses you out. It makes you calm and approachable and even as a little bit of a natural diuretic. So it's great. You ovulate, you lose some water weight from the estrogen part of your cycle, and you feel great and sexy, but you don't get that in menopause. It's in the perimenopausal time frame. It changes. So What I do with women in this phase is a lot of symptom management. So sometimes we'll use anything, lifestyle changes, dialing in blood sugar. We use different herbal compounds to help either give them a little bit of estrogen or help you detox your estrogen because your highs are too high. Sometimes we do bioidentical hormone therapy, which, if you are getting hot flashes and not sleeping and you're moody and you can't have sex because it hurts, how well do you feel as a woman? And brain fog, because estrogen helps keep you sharp. How do you feel? You feel pretty crappy. So some women have very severe symptoms. Some women are very like, oh, yeah, I was a little moody for like a week, I'm good. But for those women that get really severe symptoms, I will often step in and always dial in the lifestyle first, but sometimes just do bioidentical hormones because, if you're not sleeping and you're grouchy and you can't go to your job and different things like that, or do whatever activities you do, then that's a very low quality of life. So we're going to give you some hormones for a couple years at the lowest dose that we need to, and they're all bioidentical, so they carry very, very low risk for anything. And we're going to monitor you and watch you, and your symptoms will improve. Then, as your body gets used to this new normal and you are officially in menopause, we'll take you off of them gradually. But hormones should be used as, I believe, to get you through the transition. I don't think we're necessarily designed to stay on hormones really long term, though some practitioners do that, and they do believe that.
So is it only estrogen? Because I've read stuff about estrogen in older,
Mm-hmm.
because I'm in perimenopause, and so I did a lot
Yeah.
of research into estrogen, so I got on progesterone,
Yeah.
and it took away that desire to strangle my husband.
Yeah. Yeah.
The lack of sleep and all that, like I have.
Yeah.
I feel like I'm normal
Good.
again.
Good.
Because
Yeah.
of the because of the progesterone.
Yeah.
The doctor kept trying to shove estrogen on me, and I felt like I'm still ovulating. I don't need
Right.
estrogen.
Yeah.
I don't know.
Yeah, and that's very wise. Sometimes women are so estrogen deficient in this time frame, like they're more on the lows here, that we need to give them a little bit along with the progesterone, both of them together, so that they feel okay. It's really individualized. So you listened to your gut and did just the progesterone and it worked for you. Sometimes with women, I'll do like estrogenic herbs like black cohosh, maybe some, I don't do this a lot, but it can work, like soy isoflavones, which helps to kind of, what's the word I'm looking for? It can stimulate, but it can also block estrogen from binding, and it depends on the person of how it's actually used. But sometimes we do those types of things to get it up a little bit more, and then figure out that you're progesterone deficient, and then do that. Some women, it really just depends on symptoms and how they present and how severe it is. But I give women estrogen and progesterone and testosterone and DHEA. What's the other one? I think I covered all the bases. But I sometimes give women all four. And you guys haven't heard about DHEA yet, just because I haven't talked about it. But DHEA goes into testosterone. Testosterone goes into estrogen. And it also, many steps, helps you make cortisol and progesterone. Ooh. So DHEA is what we call like a building block. It's at the very top of the cascade. And cholesterol is at the top of the hormone cascade. So number one, you got to eat healthy fats, the good stuff, like coconut oil and avocados and nuts and seeds and, really high quality grass-fed butter. And my phone is freaking out again. Get some healthy fats in there so that you can make the building blocks of hormones, which is a cholesterol molecule. and then you can make the hormones. But most of us eat enough fat, especially with the keto craze going on right now. But sometimes DHEA levels are low, and these get depleted by stress, all different kinds of stress: physical stress, travel stress, emotional stress, diseases, leaky gut, all the things. And so sometimes if you don't have enough DHEA because you're frazzled, you're stressed, and your nervous system is going crazy, then you're not going to have enough testosterone or estrogen or progesterone. So sometimes I'll go all the way upstream, give people DHEA, and then we don't necessarily need to give people something like an estrogen or a progesterone or testosterone. But testosterone in women gives us our libido, our motivation. It helps, keep our hair around. It's kind of like that internal oomph that you have. So if you're feeling super unmotivated, your libido's gone, and like sometimes you notice changes in muscle strength too, muscle mass, that might be harder to keep on, then that can be a sign that you have low testosterone. So sometimes we need to supplement you with that. Sometimes we can do other things that will help feed down the biochemistry, like starting with DHEA. So it really depends on what the labs look like. And I do run labs. You can run labs for your hormones no matter what age you are. If you ask your doctor, your traditional doctor, they will say, oh, it fluctuates too much, it doesn't matter. Which, they're right. It does fluctuate a lot, but it does matter. And you can test in a very specific time in your cycle, which would be here, day 21-ish, if you have a perfect cycle, when you're in, this period of time, which is most of the years for us women, and see where your hormones are. So I will, even if you're a teen, we can run this. Even if you're in perimenopause, we can run this. Even if you're in menopause, we can run this and get information. Because if you look really low on a serum blood test, your gland is just not making a lot of that hormone, which is sometimes normal, like in menopause. But if you're trying to get pregnant and your estrogen's low, oh, that's a big issue. We need to treat that. So there are doctors that will say hormones don't, you can't test hormones. And they just don't want to. Or they don't know how to read a hormone test or even know what to do with you as a cycling woman. Because our physiology changes. That's why the majority of studies on Earth are done on men, like 30-year-old men. Most all of our study information, all the studies that we have, is all on men because their physiology stays the same all the time. We women have changes. This is us every month, all the time, until we get here. So we are considered too difficult to study, which is totally not true. So that's a whole other, I get on rabbit trails, you guys. But let's see, what was I talking about? Hormones and supplementing. So we do what we need to do. We can test it. So I will always do a serum blood test. And I will also often pair it with a urine test. The reason why is because so I use a test called the Dutch test. It's like dried urine. I can never remember what it stands for, but it's an amazing test. It looks at all of these things and more. It's a urine test, so it's looking at urine metabolites of hormones. Because I want to make sure that you are making enough hormone from the gland that we're considering, but that you also can do something with it. You can detox it appropriately. You can use it. So sometimes we don't make enough hormone, and that's the problem. Sometimes we make tons of hormone, but we can't detox it, or we're not using it properly, or we're missing a vitamin for that biochemical pathway and we can't push it through. So that's what a urine test will help me with. So I'll do blood, snapshot in time, what is your gland making in that moment? And then I'll do urine, what is your body doing with it? How are you detoxing it? Now, some people will also test saliva, which saliva is a really good way to look at the free levels of hormones. And saliva is also useful if you're doing any transdermal creams. to test for any sort of overdose. But in general, it just depends on the person and things. But
So
yeah.
the creams or birth control or any of that
Mhm.
shift the test?
Yeah. So if you are a person in this period of time on birth control, we can do a serum hormone panel. You can hand it to me and I will say, and not tell me anything about the person that the lab was drawn on, and I can say, that person looks like she was on the pill. Because everything's low. Your sex hormone binding globulin's up, and testosterone sometimes changes, sometimes doesn't. So I can tell just by looking. So sometimes we don't run a serum blood test if someone is on birth control, because it doesn't always tell us. Well, it just, you're not making the same levels as you would. Your estrogen on the birth control pill is 30 maybe, and same as in menopause, 30, 20, 10, something like that. But in your fertile years, your estrogen is like 75 to 220, sometimes higher if you've got a lot of estrogen running around. So like 30 versus like 150, 175, 200, which is the norm, that's a huge difference. So yeah, so birth control will change it. Depending on what bioidentical hormone we're using, that will change what test we pick. We can also do this urine test, like say you're on the implant, or you're on a hormonal IUD, or you're on the birth control pill, and we want to see what's happening to your body because of those hormones. Are you handling it okay? Do you need more support? We can run a metabolite urine test and check those things. The one reason why I love this test too, you guys, is because, let's see, how are we doing on time? One system that we haven't talked about, which I'll talk about a little bit, I guess right now, would be your adrenal glands. So let me do this. So what are these? Yes! I mean, it's super hard to tell, so I was just playing with you guys, but these are your kidneys. They're not attached. This is stretched. Uterus down here. Yeah. It's never like, if it's anatomically correct, I will tell you. These are your kidneys. You've got two of them. And you've got two little glands that sit on top of your kidneys called your adrenal glands. Have you guys heard of these at all? A little bit. Yeah. These little glands are so important. If we didn't have them, we'd be dead. Honestly. Because we need cortisol to be alive. Cortisol, they make cortisol. Cortisol helps our immune system. Cortisol helps us deal with stress. It's those two things alone are huge. Cortisol helps us manage our blood sugar. So it has a lot of functions. We make cortisol every day. It's literally the hormone that rises in the morning and wakes us up. So if you're feeling really draggy in the morning, like, plug me into the wall or give me coffee, or I want to sleep another 3 hours and then maybe I'll be awake, your cortisol awakening response just might suck. It just might be way too low. And good news is that we can fix that. We can work on that. Other things can cause that too, but just wanted to mention that like early morning dragginess when you get out of bed can be just you have low cortisol in the morning when it should be high. So your adrenal glands make cortisol. And when we are in menopause, your adrenal glands are very, very important because they make sex hormones for you when your ovaries stop. So in menopause, or let's go back over here. In your fertile years, your ovaries make 80% of your hormones. 80%. The other 20 come from your adrenals. So it's 80-20. Sex hormones. 20 is the adrenals. Ovaries, adrenals. When we get to menopause, complete shift. You go from 20, goes from 20-80. Ovaries make and this is maybe, because most of them really just chill out, maybe 20%, and then your adrenals make 80% of your hormones. So, what's happening in this time frame of life? If you're 40, 41, 42, 45, 50-ish, this is a lot of transition time for people. Children are going off to college, people are moving, people are buying new houses, trying different careers. A lot of divorces happen during this time. There's a lot of stressors and a very natural need for women to like transition into the next phase of life. But if you have stress that is not resolved, you're going to be stressing your nervous system out. You're going to be stressing your adrenal glands out. They're not going to be able to make cortisol. You're going to be draggy. If a hormone system is not working, it affects the others. So your hormones are, if I drop down here, can you see it? Your hormones make up a stool, three-legged stool. What happens if you take a leg of a three-legged stool away? Falls over. So the stool is made up of your adrenals, your thyroid, which we haven't really talked about today, and we probably won't at this point. And for women in this discussion, your ovaries. These are where all of our main hormones come from. So if you get to this stage of life and you have work and kids going off to college and you're getting divorced and you're buying a new house, mega life change, right? Mega stress. This is going to affect how your adrenal glands function negatively. It's going to either rev you up or tank you. And the stool is going to go, pfft. If your adrenal glands don't work very well, you can't make cortisol, which is kind of your get up and go, and your immune system, so you're getting sick more often. But what do your adrenal glands make for you in menopause? Hormones that your ovaries aren't making anymore. So you're not only losing your hormones naturally because of the transition that we all have to do as women, but your adrenal glands aren't supporting you. Your adrenal glands kind of come in the background and they essentially save your butt. They are the ones that are like, oh, I got to pick up the slack. Now the ovaries are, not working as much. It's time for me to shine and make hormones. And so women that have managed their stress, have done self-care, that take care of themselves, and have, throughout this time frame, they will have an easier menopause by far, regardless of their genetic predisposition and their history. So, in this time frame, the biggest thing that I work with people is how do we get rid of # minimize stress? And that is stress from all different avenues: physical, mental, emotional, spiritual, everything. Because if your adrenal glands are shot, you're just not going to feel good. And if I don't have this supportive system, if the whole leg of the stool is down, then me putting supplements and herbs into your lifestyle and me putting bioidentical hormones into your lifestyle maybe will help your symptoms for 2 to 3 months. And then you're going to come back to me and be like, that worked really well and I feel the same now. Because we have to fix the basics first. So I always will consider the adrenal glands for, everybody on this whole wall, but especially in this time frame, because the adrenal glands are going to make those sex hormones that you're now missing, and they're going to save your butt. They're also going to be helping you deal with the stress. And in the Dutch test, see how I did that? We can do a 4-point cortisol curve and see how your curve is throughout the day. Are you making enough cortisol? So your cortisol should be high in the morning, peak, and then trickle down throughout the day like this. So this would be like 10 p.m. and this would be like, 7 a.m. When do you all normally wake up? Something like that. And then the highest peak of cortisol, which is here, happens 30 minutes later. So your peak cortisol is about 30 minutes after you wake up. I'll do the urine test, which tests 1, 2, 3, 4 points, so we can see how your curve is throughout the day, which gives me a really great view. Because some people come in, you guys, and they're totally flatlined, and so I know, oh, you're probably feeling a lot worse than you maybe even know. Because the thing that we do really well as women is kind of drag our physical bodies behind us, leading with our emotional side. You know, we got to take care of people, we got to do our job, we got to do X, Y, Z, and we're often the last ones to think about ourselves or our physical reality in our bodies. So it's my job to get you physically and emotionally on the same track. Because sometimes life is really good at this point for women. Like the kids are going off to school, husband is great, moving. It's, you know, can be a fun part of life. It's not always stressful. But if you don't have cortisol helping you, you're going to naturally just feel really behind. And your emotions and your physical won't be congruent. Yeah.
Can you, because I've heard of adrenal fatigue,
Mhm.
can you fix the adrenals at any age?
Yes. Yeah. So everything in here that I've talked about, you guys, is fixable. It's all fixable. If you have adrenal fatigue, which, you know, if we talk about adrenal fatigue, someone eventually is going to be like, but the adrenals can't be fatigued. So we call it adrenal dysfunction. Okay? Let's rewrite the script on the adrenal fatigue. Just like your ovaries get dysfunctional, your brain gets dysfunctional, your liver gets dysfunctional, the adrenals get dysfunctional too. So yes, if your adrenals are tired, which there's a certain compensatory way that you'll go when you have a lot of stress. Your adrenal glands will put out a lot of hormones and everything will be ramping up until they're like, oh my gosh, I can't help you anymore. And then you tank. So I can catch anybody on that compensatory curve, and then I can also catch people over here where they're like, they've burned themselves out. But no matter where you are on the curve, you can fix that. If you're all the way over here and burned yourself out, it's harder to heal than someone over here that just really needs to calm down and stop being so stressed. But yeah, you can, if you have some sort of low cortisol, high cortisol issue, very, very fixable. Most of this, honestly, you guys, is fully lifestyle. And also like mental, emotional perspective. Because our emotional perception of things affects our physiology and how our hormones work. So sometimes people will come into me and they're like, I have this stress. It's not going to go away for about 5 years or whatever. We talk about timeline. And I'm like, okay, well, it's time to seek out some help with helping your brain deal with it. So mental health is a big thing, mental emotional health. So sometimes we'll do EMDR therapy. We'll do talk therapy or stuff probably that you do. We'll do, biofeedback sometimes. Just so many different things. Often learning how to reframe ideas too, put things in perspective can be really helpful. So then, that 5 years, you're not constantly in that state of panic. You have a way to deal with it mentally. Because if you're not dealing well with it mentally, it's going to affect your physical. And, no matter where you are in this, you can always get better. A lot of people will say, like, oh, I have PCOS and it's just going to be like this. Or, I'm really, really stressed. It's going to go on for the next 2-3 years. I can't really do much. And it's like, no, you actually can. You can do a lot and small changes add up. Okay. What else? So we talked about hormones a lot. Does this make sense? How your hormones change as a woman? They start at nothing or, minimal as a child. And then they're all up and down, going up. And then they're nice and even. And then they start going all up and down, going down. And then you're at a new normal, a new baseline. And that affects our whole experience throughout our whole lives as women. Ta-da! Any questions or things we didn't talk about? The thing that I'll say about the osteoporosis is that estrogen is a very building hormone. So, when we are growing, when we are teenagers. We are putting down a lot of bone. We're taking in hopefully a lot of calories, a lot of good nutritious calories. Our metabolism's doing great. We're getting a lot of good calcium and magnesium and all the other little minerals that we need to build bone. We're laying down all of our bone, 13, 14 to 18-ish for us women. And then we keep that bone, or we want to keep that bone, for as long as we can to the end. If you have a history of not getting good nutrition when you were young, or history of an eating disorder, or anything that's going to take away nutrients, your bone that you put down is not going to be as robust. So when you get over here, you're going to be more prone to having osteopenia or having osteoporosis. Often, so it depends on the history too, because what I see sometimes in here is people going on lots of different calciums, minerals, and that type of thing to help keep their bone. If you didn't put down good bone, there's only so much bone you can keep. Yes, for some people, calcium is a good idea. What is really the best for osteoporosis is weight training, weight-bearing exercise, because your muscles and your tendons pull on the bone. And when you have that physical stress, you actually help to build bone. So, minerals, which you get in all the salad stuff that you eat, weight-bearing exercise, and there's one other thing that sometimes I recommend. It'll come to me in a second. But that's generally what I recommend to people. If they have like certain Z-scores, sometimes we have to go on, a drug that changes things. But they don't always help with keeping the bone around. Like, what's the common one? I always forget its name. Fosamax, yeah. Yeah, so it helps. It actually, they've done studies where it keeps the bone around, but the bone is more holy than it should be. So it actually becomes more brittle over time. But that's a very personal decision that you have to look at, like your DEXA scores and stuff like that. But in general, estrogen is a very building hormone. So it helps keep our bones really strong and robust. So some people women will see a decline in bone health once your estrogen starts to drop. So, sometimes we will do a little bit of estrogen for people for bone health as well. But really the biggest factor is, what were your bones like here? Were you getting good nutrition? Were you getting enough minerals?
Post-menopause, but
Mm-hmm.
that's how
Mm-hmm.
low Z-scores, osteopenia and osteoporosis.
Mm-hmm.
Do you have any opinion about taking low
Yeah.
dose bioidentical estrogen?
I mean, in technicality, it would help preserve your bone health. I would have to compare the research on what would be more effective, because calcium supplementation, they've done a ton of research on, and there's a certain point where it essentially times out. Like, increasing your calcium is not going to help you keep your bone around because it's so estrogen dependent. So the research would really answer that question for us. In theory, doing a low level of estrogen might help you.
Without causing
Mm-hmm.
an increase in breast
Mm-hmm.
cancer?
Yeah, because all the hormones that I use are bioidentical, so their cancer risk is negligible. And we're also doing small doses, you guys. We're not doing huge doses. The reason why estrogen supplementation has a bad rep cancer-wise is because when they first created estrogen, they got it from horse urine, and it was called a conjugated equine estrogen, which that's natural and great, right? Not a good idea. But they are giving it to women, and it was helpful for them, but they didn't know that the effects later was that the estrogen that they were giving was just too much, too harsh, too stimulatory. So, it gave women different cancers: ovarian, endometrial cancers, uterine cancers, breast cancers. But the hormones that a naturopathic doctor or any sort of functional medical provider will do is not a synthetic pill form of estrogen. We usually will do a cream, and it's usually always bioidentical.
Do you think that's safe?
Mm-hmm. Yeah, it's really safe. I mean, unless it depends